Well, welcome. My name is Robin Novak. I'm a registered nurse in CIC with Excellentia Group, and today I'm here with Caleb Paige, the Safety Director for Faultless Linen. So, Caleb, can you talk a little bit about the value of the healthcare laundry accreditation and why a facility would want to find it a beneficial asset?
Sure. So the HLIC certification validates a laundry operations entire process pretty much from the time we take custody or control of soiled linens from their facility until the time that the clean linens and that custody and control is returned to the customer. The HLAC standards are pretty comprehensive and detailed. So day to day for us to achieve and meet those standards and comply, if you will, it kind of shows that commitment to meeting our customers' expectations and needs as far as patient care and patient quality at the end of the day.
Wonderful.
Quality care. Yes, ma'am.
So in many areas, the HLAC laundry facilities are not available. Can you discuss what the infection preventionists should look for when they're touring facilities?
Sure. So independent certification, Robin, is kind of becoming the unofficial minimum standard when it comes to healthcare laundry or launders approaching and preparing RFPs, the request for proposal for different facilities. So for facilities that may not be in a service area where a certified provider or certified laundry operates, the HLAC does offer a couple of pretty comprehensive checklists that are reduced versions of their full standards document. And these are a good tool for infection preventionists to use when touring, and also for members who may not be certified or may not be in that area to kind of benchmark themselves in their day-to-day processes against.
Oh, that's really great. Very good. If a facility doesn't have the HLAC certification, would that mean that they're not appropriate to utilize for cleaning healthcare laundry?
No, not necessarily. So the value added from the HLAC certification and accreditation program that we find is in understanding our customers, the ASCs, their challenges, their concerns, and the areas of need that they need from us as their laundry provider. So we find that from the HLAC or the Healthcare Laundry Accreditation Council, they have both board members and inspectors that represent both the public and private healthcare sectors. And then the the standards, the documents that we're assessed by, that kind of reflect how healthcare facilities or ASCs are assessed with government compliance. Mm-hmm. So for us, that gives us a direct channel into the ASC's mm-hmm. areas of concern, needs from the laundry provider, and in our experience, that's the biggest differentiator in working with a certified laundry.
Okay, so it's not a bad idea. I mean, it's not necessarily a bad thing if they're not certified, but there are some guidelines that they can look for. Okay.
Absolutely. Yeah.
Very good. So are there alternative certifications besides the HLAC, and can you speak about that?
Sure. So the Textile Rental Services Association, or TRSA as they're referred to, TRSA is a trade association that is made up and represents industrial laundry member operators. They offer member services or staff services, everything from government affairs and regulatory items all the way out to educational services for certified members. And in their certification business sector, they offer what's called the TRSA Hygienically Clean Healthcare Program or certification. And that essentially is two parts, that certification. The first of which is ongoing independent lab testing. And what that is testing of our clean textiles or processed textiles to rule out the presence of microbiological contamination from bacteria. And then that's basically a quarterly sample that we send in of completed linens. And there's a whole process that you follow. You send those into the lab, and they do the independent testing, and you get the results. And there are certain compliance benchmarks and contamination levels that you have to stay under or within. And then the second part of that accreditation is a plant inspection that assesses obviously the laundry, the operation itself, and then all the processes within. And it assesses those against what are called their best management practices as their standards document.
Okay, awesome. Very good. So either one of those would be a beneficial accreditation or Yeah, for a facility to have. Okay,
Absolutely.
great. Very good. So where can an ambulatory surgery center representative go to learn more about the guidelines for healthcare textiles?
So both of these certifications, both the Healthcare Laundry Accreditation Council and then the TRSA Hygienically Clean Healthcare Program have their standards documents. Both of these are readily available on each of the respective companies' websites, and they offer a very in-depth look at what we as an operator commit to every day, and the goal that our customer, the ASC, has in providing quality care and patient safety every day.
In either one of those, can healthcare laundry be laundered in the same cycle as your scrubs that facilities are using?
So for each textile classification or individual textile item, at the end of the day, to ensure a patient-safe product and consistency and cleanliness and textile specs, each textile should have its own individually established wash formula. And again, those are derived from things and or factors such as textile specification, so weight, type, what's its makeup, its intended use within the ASC, what is it being used for, and then things like the estimated the soiling of the textile itself. All those will kind of differentiate and go into what each textile's wash process formula should be.
So you mentioned something about depending on what the textile is being used for. What about things that are going into sterile packs? Do you have a means of processing those?
Yes. So as far as the wash process goes, there are specific formulas like there are with each individual textile. So if it's a terry item or a flat item, etc., it's going to eventually go into a surgical pack. Where it changes from a processing standpoint is it will, instead of going to a general flat floor to a finishing station like an iron or etc., it will actually go into a pack room, which is a sterile environment. It's controlled, has its own air handling system, and then that's where the packs will be built, as opposed to your normal flat floor items or bulk items.
Wow, that's amazing. So what is your recommendation of how soiled linen should be transported from our facility to your facility?
So functional separation between those soiled textiles that we're picking up at your facility must be maintained from any clean textiles that are on the same vehicle. And that has to occur, that functional separation during any handling, collection, and transportation of those textiles back to the facility, to the next customer location stop, whatever it may be. So kind of the first part of that is fluid-resistant containers or laundry carts, like we'll see out here in our plant, so that there's no leakage occurring outside of the container. And then once those carts or those containers are placed on the truck, those should be secured within the vehicle to prevent spillage.
And then are they covered in the truck to keep the contaminated from coming in contact also?
Yeah, so all of our locations use either a disposable plastic bag, soiled linen bag, or a reusable, which is also fluid resistant or fluid proof. So you have those first two layers of protection inside the bag, and then that is placed within a fluid proof plastic container or laundry cart. And then yes, a disposable plastic cover also offers that third layer of protection.
Okay, so I'm having a hard time grasping this in my head, so bear with me. When I'm looking inside the bag of, I'm assuming these are like semi-trucks or a box truck.
Sure.
Is one side clean and one side contaminated, or are they just kind of all mixed in there?
It can be a combination of either.
Okay.
It can be, you can have a soiled cart next to a clean cart. And again, part of that component is you can achieve functional separation through space. So having that space so that those linens aren't coming into contact with one another.
Okay, very good. So sometimes when we get our laundry back, it has a sour smell. What causes that?
So that is actually from a chemical that's referred to as sour in our wash process. And so what the sour is only intended use, that chemical's intended use or purpose in the wash process is to lower the pH on your linen items back to the level of human skin. And that's at the very end of the wash process. So sometimes you'll get a little bit residual smell from the sour itself.
Okay, very good. And as we go through and look at these types of facilities, what is an acceptable rewash rate?
So our goal every day in our operation is a 5% rewash, and we try to achieve that through training operators in our quality control standards for all the textiles that we offer to customers.
Okay. What qualifies for needing to be rewashed?
So we have stain treat. So if there's a visible stains, there could be things, one of our other ones is if a linen touches the floor or a contamination point during processing or a finishing station, and you'll see rewash bins located throughout the facility at all the operator stations.
Okay, great. And what kind of expectations should an ASC expect for laundry facilities regarding found sharp objects in soiled linen?
Sure. So working directly with infection prevention professionals and ambulatory surgery centers, I can attest to the fact that they take that very seriously. You know, the inadvertent misplacement of a medical sharp. So at a minimum, each laundry or each operator should have a means of communicating that information back to the ASC or the customer, so that internally the ASC can check all their processes, and if need be, implement additional controls or work procedures, et cetera, to prevent that from occurring in the future. But some additional best practices would include things like the laundry having a process or a verification process validation to identify where the sharp came from regarding facility, and secondly, if you can even drive that down further to which department from in the facility it came from, there's a lot of value in that. Another one that we often hear from our ASCs and our infection preventionists is they all obviously want to verify that proper disposal has happened with the sharp once we identify it. And then another value add can be things like a sharp that can help in that investigation process for the ASC and in identifying which department maybe it came from.
Okay. And do your employees have some type of bloodborne pathogen training to go along with that in the event that they do have an exposure?
We do. Yes, we offer bloodborne pathogen training annually, and it's also a new hire orientation item. And then we have some supplemental training items that go into our areas where we have expected exposure, and then our whole operation operates under universal precautions. So we're assuming that anything that comes into our facility is indeed contaminated.
Okay. In the event that you would find something that's not a sharp or some other type of foreign material in the linen, do you notify the facility of that?
We do, and we handle that the same way, just due to the fact that it's probably been in contact with a soiled textile.
Okay.
So we bag those items, and then we have a flow chart internally that we follow, kind of a processing flow chart, and then we notify the customer of what those items are, what the contents may be, and then we typically will follow our own process, but if it's something like medical instruments or medical technology, that adds a layer to the final outcome of handling.
So if you
this.
find my wedding band attached to a little safety pin, I might find it back.
Yes, you very well
Great.
could. Absolutely.
Very good. So tell me, do you have some contingency planning in the event that you lose power or there's some type of catastrophe that's happened in the area?
We do. So both of the certification programs that we talked about earlier in our conversation, that's actually built into the standards documents that we need to comply with. And our contingency program does include all those things. And the end goal is uninterrupted service to the ASCs and our customers. And so having multiple healthcare facilities that we operate with the same certifications, it allows for an easy interchange with backup facilities if it's something that extreme, that level of a natural disaster or whatever the circumstance might be.
Okay. Well, speaking of natural disasters, sometimes there's problems with water quality, and how do you validate your water quality meets standards?
Sure. So we work with local jurisdictions from a regulatory standpoint on wastewater. And then we also, through our chemical vendor in our operations, we go through water testing as well that helps validate what levels of discharge is going out in our water, et cetera, and that we're staying at a compliant level with local regulatory bodies.
Okay, good. So when all this soiled linen is coming in, how do you clean that area? How do you disinfect that so that it's safe for your employees?
Sure. So we have a kind of a floor-to-ceiling janitorial or housekeeping plan in place. And kind of the big one for us is that you have a plan that you can follow and that it's being followed and documented. And then kind of some sub-items or subcategories that go into that for us and for our customers is a chemical or a sanitizing chemical that EPA registered, as we'd often see in a healthcare facility, and typically parallels what our customers use.
Okay, great. And are there specific temperatures that you use when you're performing the laundry wash?
Sure. So typically what you'll see is that the laundry, the wash process reaches 160 degrees. Is kind of that baseline or kind of that industry standard. But with some of the advancements in chemical technology, now there's suitable low temperature wash processes that have the same ultimate cleansing or sanitizing effect on the linens that we're servicing and processing.
Okay. And so as we talk about water again, do you have some type of water recycling or retrieval resource or anything
We do.
that you try to save some of
We
the
do, yeah. To exercise our environmental
Yeah.
engineering, we do. We have water treatment and recycling in all of our facilities.
Great. Okay. Well, I really appreciate your time today, and we've gone through a lot of information, and I know that you have much more to share, but thank you so much for everything.
Absolutely. Thank you, Robin.
Thank you.